Hi, I'm Muriel Bowser. I am the mayor of Washington, D.C., and I'm joined by members of my cabinet to provide an update on the district's response to COVID-19. First, I'm going to announce some phase 2 adjustments, and then we have some important relief updates for businesses and for residents and businesses. This morning, we announced 183 new cases of COVID, and sadly, four Washingtonians succumbed to the virus since we last provided an update. Here you can see the metrics that we post daily. Beginning today, we will also post on our website summary information related to outbreaks that we can look back over the course of our response to the pandemic. This data will be updated once a week on Mondays. I will note that outbreak sounds pretty scary, and the way DC Health defines an outbreak is 2 or more cases reported at a location within a 14-day period. So 2 or more cases at a defined location within a 14-day period. You'll remember that based on recent trends, 2 weeks ago we made some adjustments to phase 2 activities, and I mentioned that I would be talking more about sports and recreation. We lowered the maximum number of people allowed at an indoor gathering to 10 people and lowered the outdoor gathering size to 25 people. We limited the sale and consumption of alcohol at restaurants to 10 p.m. and lowered the capacity for indoor dining. We suspended our live entertainment pilot, and we put restrictions on group exercise. We announced, when we announced those changes, I mentioned that we would have additional adjustments as warranted. Starting today, high contact sports are prohibited in the district. Here you can see a list of those sports that are considered high contact. Obviously, this restriction is due to the amount of contact and type of contact people have when playing these sports. This does not apply to universities and professional leagues, which need to have approved health and safety plans. Next, you will see that we have broken out our restrictions on youth sports into 2 groups. Those groups are high school-aged youth, and the second group would be children who are not high school age. The decision to do this is tied to observations around unsupervised interactions that are happening before and after activities with older students. So high school extracurricular sports activities and competitions are suspended for DC public schools, public charter schools, private schools, parochial schools. Recreation centers and sports clubs must also suspend physical sports and organized athletic activities, including practices, clinics, and competitions for high school age athletes. This applies not only to high contact sports, but to other sports and physical activities as well. We have been in communication with the District of Columbia State Athletic Association, and they have already notified schools that they're pushing their return to practice date from December 14th to February 1st, 2021. Children and teens who are middle school age and younger may continue to participate in organized drills and clinics for high contact sports, provided that the athletes are cohorted into groups of no more than 12. So that means they can participate in drills, but not in games. The activities do not involve physical contact with another person. And for all grades, physical education classes must not involve activities where students might come within 6 feet of one another. Finally, the Department of Parks and Recreation will stop issuing permits for organized sports and team play at DPR fields. Any organization holding an existing DPR permit involving physical contact may only use the permit to conduct no-contact drills and workouts for children younger than high school or for adults. We will post the mayor's order outlining these updates on our coronavirus.dc.gov /phase 2. In addition, you will find guidance from the Department of Health related to sports and recreation. Now I want to move on to talk about our recovery and more to our recovery update. Very clearly, a lot of Washingtonians, a lot of Americans are not only suffering with the anxiety and health implications of this virus, but economic devastation as well. And we know many people are struggling and will struggle to get to the end of the year, and on the other side, when hopefully there is relief from the Congress of the United States. And while we continue working to ensure that everyone has their basic needs met, I want to continue to ask people to go to our website at coronavirus.dc.gov, for example, to find a list of all the food resources that are available across the district and make sure you and your family are taking advantage of them. We also know that there will be a lot of discussion about what the federal government can do, and I have sent a letter to the president-elect outlining some of the major concerns the people of the district have. But let me move on to talk about an immediate need that we will invest a portion of our CARES Act to provide a round of local stimulus. And this stimulus payment will be made to D.C. residents currently receiving pandemic unemployment assistance. With pandemic unemployment assistance, or PUA, set to expire at the end of this month, D.C. government will be providing, I feel like I have a mask here, sorry. Thank you. D.C. government will be providing a $1,200 one-time stimulus payment to unemployed Washingtonians who are not eligible for additional unemployment and have been participating in the PUA program as of November 30th. It has been a while since we've talked about this, and Director Morris Hughes is here to talk about what PUA covers and individuals who are not eligible for traditional UI. Those include individuals who are self-employed, seeking part-time employment, individuals lacking sufficient work history to participate in traditional UI, independent contractors, gig economy workers, and those who have exhausted their benefit eligibility under the traditional unemployment and pandemic emergency unemployment. This local stimulus payment, again, goes to D.C. residents who have filed for pandemic unemployment assistance as of November the 30th. We estimate that we can reach about 20,000 Washingtonians with these payments. Finally, I want to draw everyone's attention to the Restaurant Bridge Fund applications. A few weeks ago, we announced that we are investing $100 million in a bridge fund for DC businesses. You will remember that this fund is providing relief to businesses and workers in the hard-hit sectors of our economy, hospitality, entertainment, and retail. And here you can see what types of those establishments will be eligible for. But today, the Restaurant Bridge Fund application goes live. So please check into our coronavirus.dc.gov site to learn more. And each week, Deputy Mayor Falchicchio provides an update on our recovery, and it's broadcast from this room. And this week, there will be a focus on the restaurant applications. So tune in. So with that, we will take your questions. Any questions?
If we could on the unemployment benefits, and if we could just clarify, because I think you said DC residents, but as we know, DC, you collect where you work, not where you pay. So are these $1,200 payments specifically for DC residents who work in DC as gig workers and collect unemployment in DC?
Yes, they're for DC residents who have applied for PUA as of November the 30th.
So a DC resident who's a gig worker outside of DC would not qualify?
It's for DC residents.
But a DC resident who works outside of DC as a gig worker, would they qualify?
Are they in the PUA program?
No, they have to have an application filed here in the District of Columbia, which means they have to also work in the District of Columbia.
Okay, and my last just clarification on this. So if they have applied by November 30th, but have not yet been approved, they're still eligible for this?
That is correct. They are still eligible.
Okay.
Applications have to be in by September 30th.
Okay, thank you.
November 30th. Thank you.
Right.
November 30th.
Sam.
So, first off, tell us a little bit about what a PUA worker is as opposed to someone else. And
Sure. So the Pandemic Unemployment Assistance Program was developed for those that are not necessarily eligible for the traditional unemployment insurance program. So that means if you're a gig worker, a 1099, someone who doesn't have sufficient work history, or may not otherwise be eligible for the traditional unemployment insurance program.
And so have they gotten payments before under the previous system?
And Unique, if you could just talk a little bit about, as the name suggests, it is a new program to respond to COVID, and just kind of give some of the history of how we have this program.
Sure, that's correct. So PUA is one out of 6 programs that every single state has been administering. This is a brand new program. It did not exist prior to the pandemic. It was authorized and created under the CARES Act. There may have been individuals in some cases, like the criteria list, that could have received unemployment insurance benefits maybe a year or two ago that may be chronically unemployed. But this is a brand new program. And so this particular group of individuals are not eligible to participate in the traditional and standard unemployment insurance program.
And so, for example, if they got some money through this program before, do they automatically get it with this extension?
Yes. So if they have an application in by November 30th, they have been filing claims, weekly claims, and they've been receiving funding, they are eligible to receive the $1,200 benefit.
So they don't have to do anything?
There's nothing that they have to do.
And the difference, Sam, with this program and the traditional unemployment is it has a statutory end of this year, December 31st, unless it's re-upped by the Congress.
And so this is all from the CARES Act money?
We will fund this as part of the CARES Act funding. Yes, sir.
Are we seeing any effects from Thanksgiving gatherings in our COVID data yet? And could you talk a little bit what you're hearing about from contact tracers, maybe for Dr. Nesbitt?
What we're doing about what?
What you're hearing from contact tracers
Sure,
with that regard?
Dr. Nesbitt.
Sure. So, as you all may have noted, our 7-day rolling or moving average in our daily case rate has continued to increase. And that's similar to what has been seen across the country. As our contact tracers continue to interview individuals, unfortunately, we still only have about 73% of individuals who are completing the interview. We are noting that individuals are reporting some activities related to the Thanksgiving holiday.
Is that anything significant, notable about, I mean, can we trace it to Thanksgiving gatherings, or is there anything more specific to say about that?
What do you mean in terms of can we trace it to Thanksgiving gatherings?
Sorry, the rise in daily case numbers.
Well, I think most prudent people would draw the conclusion that as we were anticipating in public health, and most of the nation was anticipating, that if people did not stay home and only do things with their household, then we would see a surge on top of the existing surge that we were seeing. So now in the District of Columbia, we've gone from a daily case rate that was in the 20s to a daily case rate, a 7-day daily case rate of 100,000 population. That's 34.3.
Mm-hmm.
And we are now almost 2 weeks out, so like 10 days out from Thanksgiving, which I think is the time period where you would, from Thanksgiving, where you
Exactly.
see more cases.
Right. So, so on vaccines then, the U.S. Department of Health and Human Services told us that basically residents should expect to be vaccinated based on where they live, not necessarily where they work. I'm wondering if that's your understanding as well, given previous statements, and if you've gotten any assurances from maybe Virginia and Maryland that is the case?
That would be different and contrary to what was published in the original CDC playbook, and actually in the second version of the CDC playbook, if that's the statement that they're now providing to you all upon inquiry.
Okay.
Yes, sir.
So, Dr. Nesbitt, as you mentioned, the daily case rate is now far worse than it's been at any point during the pandemic in D.C. so far, including during the stay-at-home order in March. And the city just topped 700 deaths. The percentage of people hospitalized for the virus has increased daily also since mid-November. So I'm just curious at this point if you guys are giving any consideration to returning to the stay-at-home order and closing non-essential retail at this point.
Well, the question was directed to me, and the mayor is going to add, but I think
Sure.
an additional action was taken today, and our goal is to make recommendations that allow us to target things that we believe will make a reasonable difference by populations that we believe are contributing the most to the increase in cases. So I know the mayor has been giving some thoughts to this as well. And Deputy Mayor Falchicchio and I had some conversations with some of our key stakeholders last week, and his statement resonates and rings true with DC Health as well. It would be much easier for us as the health department to advise the mayor to move us to a stay-at-home posture, but that would not necessarily be widely acceptable by the residents of our community, and the degree to which we would get adherence to that immediately may also be debatable now 9 months into the response. And so we have to think about how we can make these incremental changes that will give us some benefit and impact based on the populations that are driving our increase in cases, such that as we may have to dial things up, we can continue to get the greatest level of cooperation and adherence from our residents, so that we can continue to flatten the curve in ways that makes the most sense for us locally.
Mayor Bowser, you're going to add to that?
I think, actually, I don't have anything to add to what Dr. Nesbitt just said.
So the fear then of a quick transition is that people generally would not be super compliant?
Well, I will add that we always intend to dial up and dial back, just as we slowly opened and conservatively opened and maintain a phase 2 posture. If there are things that we can change to achieve a flattening of the curve in making those changes, we will.
And then DC hospitals have previously expressed some concern about staffing during the surge. Are there any steps being taken to boost hospital staff as the percentage of COVID patients is climbing?
So we've been in constant communication with our hospital and healthcare facility, I would say more broadly,
Okay.
if you allow me to expand on the question, with our healthcare facility partners throughout the pandemic response. And our primary goal, we think a lot like preventionists from the DC Health perspective, to say, what are the practices that we can put in place both at the community level, because all of our healthcare workers live in the community. And if the best job that we could do is to keep the level of community spread low, so that our healthcare workers who live in the community keep their risk low while they're not at work, and that the individuals who have to come into their healthcare setting are going to be less likely to be carriers of COVID, both with symptoms and those who are coming in for other healthcare services who may not have symptoms, but who could put those healthcare workers at risk. So that's the first thing that we try to do in order to keep that healthcare worker absenteeism low and allow the operators of healthcare facilities to have the workforce that they need. The thing that we've done now, and what's been quite concerning for healthcare leaders, public health planners across the country, is unlike the previous waves, we don't really have a healthcare workforce that could be mobilized to hotspots across the country, because essentially the entire country right now is a hotspot that would have a need for healthcare workers more broadly, which is why all of us are needing to be very strategic about things that preserve our healthcare resources, not only for individuals who have COVID, but individuals who may need to go into the hospital for other healthcare services. So we've been in touch with all of our healthcare facilities, asking them to really assess what their needs are. If all of the contracts that they put in place and all of the hard work that we did, the mayor was very forward thinking and asking our hospitals to increase their capacity up to 125%. And that wasn't just about building beds, but making sure that the workforce was there to staff those beds, ensuring that they're doing a thorough review to make sure all of that capacity is very real. And if not, what can be done from a operational perspective to scale back some of those daily operations of things that may not necessarily be essential in terms of bringing patients into the hospital, increasing the risk of exposure to workers, so that if we need that capacity, it will absolutely be there for us here in the district. And the region for the most part.
Yeah, thank you. And then 2 more questions. So you talked a little bit about contact tracing. I think you said it was a 73% response rate. So what's your assessment of how that has been going generally in the second wave? And do you guys have enough contact tracers for the program to be effective?
Yeah, it's an excellent question. It's all relative, right? I actually, in a conversation with my team today, you can be your own worst critic. And we have the benefit of having conversations with our colleagues around the country, both at the large city level and the state level. And when we interact with others, we recognize that we have a lot of great assets here and a tremendous amount of public health capacity to do the work. And while we have these goals, these lofty goals of being able to complete a tremendous amount of interviews within 3 days, many other jurisdictions are not even performing that well and getting that level of community engagement. We always want more. We set the bar really high for ourselves. Some other jurisdictions have begun already to scale back contact tracing, which happens when your case count gets really high. That's just naturally what happens in public health. So we're still able to do a lot of interviews. We're still reaching out to people within the first 24 hours of their diagnosis, and we have a really comprehensive program. We have a virtual assistant that allows people to do their public health monitoring via text message. We allow people to have a daily touch with our contact tracers to check in on them if they're a positive case or if they're a close contact. And we even offer a home visiting program. So we've got a lot of options. And what we would do first is scale back some of that work and maybe switch to every other day before we got to a place where we weren't making contact with people at all.
Okay, so you're not there yet.
Correct.
And you have enough contact tracers
Absolutely.
to continue. Thank you so much for the candidness. And then one more. Are you seeing public health behavior and compliance with restrictions change? I know we've talked about COVID fatigue before, but compared to the first wave, what are you seeing from the public? And then are you considering, and this will be for you, Mayor Bowser, as well, considering increasing or changing enforcement or penalties as it comes to mask wearing or other violations of restrictions?
I think DC residents have been amazing. I think the businesses have been amazing. I do think that the holidays and compliance has been hard. That's just kind of a anecdotal expression. And people wanting to be together. I think that's hard. And we still have a few more months of this, and going into the cold weather, all of that I think has been difficult for people. And one thing that I've said to everybody is we all have friend circles of people describing their activities and justifying all of the things that they're doing, and they're thinking through it, but we want them to limit their activities as much as possible. And be compliant with gathering with friends and family. I think that would be my biggest thing. In terms of our enforcement agencies continue to be rigorous, and that is important. And we also have, in all of our establishments, we have to kind of self-monitor too. We have a wonderful suite of guidance. But the thing about human beings, they will be human beings. And so we just have to give a reminder. I may have told you this story, so I won't repeat it, but you can see it in workplaces, for example, that people just who haven't seen each other, and we put up all this wonderful plexiglass to keep people from breathing on each other and the like. But then, they come in and they want to talk. So what do? They kind of go to the side of the plexiglass, or they stand over the plexiglass, and so that's just a very simple example of how the best guidelines and rules are in place. But we just have to be vigilant about, and nobody's, trying to, be outside the guidelines. You're just trying to say hello. But just remember that it's okay in this time not to offer the same greeting you would normally offer your coworker, and limit your conversations
Right.
when you're with a coworker. That's just a simple example. But we, for example, as we have CARES classrooms in our schools, part of the duties of the health techs that we have in the building is just to circulate in the building to give people that reminder. I took my mom to an appointment earlier today, and there was an intercom throughout the building that said, "This is your mask checkup." And I was there an hour, and I heard it 3 times. Is your mask covering your nose and your mouth? I mean, and so those are just some things to do. And I'm probably, Dr. Nesbitt is going to be really happy with me later, because this is the guidelines, and it's just little things that we all can do. And I think one of the biggest ones, I'm giving you a wandering answer, so I'm sorry about that, that people are having the most difficulty kind of getting in their heads is if you're inside your house and you have somebody at your house who's not from your household, you have to wear a mask. And that includes your brother, your sister, people that you know. And I think that's probably one of the biggest things that people haven't gotten into their head that can keep them safe.
Outside of the reminders, I think residents would be really appreciative of those reminders, and what we're seeing in businesses and schools that you mentioned. Is there any consideration for perhaps harsher penalties for things like not wearing masks in public? I feel like most of the restrictions have largely been in businesses where people will report incidents, but is there anything else that would be broader, perhaps?
So we've started to do mask audits, and I think we'll have that data ready to publish this week as well. And the compliance is remarkable in the district, and we audit at well over 100 different locations. So we go to public, open spaces, we audit in venues, public venues, and public spaces as well. So I think, we've had these discussions about putting in penalties related to the mask mandate. But it would, I think, yield very little impact based on what we're seeing in terms of the mask compliance. And as the mayor mentioned prior, some of what we see is just the need to remind people how to wear the mask correctly. I don't think it's intentional for many people that they're not wearing it correctly, like slippage and remembering to put it back on their face in the right place. So some of that work, and we've started to design some of the reminder campaigns around that. But I think you all will be very impressed with what we see with the mask audit. And our staff is not, they're inconspicuous when they're doing this mask audit. So people don't know that the health department is there looking for them to be wearing their mask correctly.
Thank you.
Thank you. Yes, sir.
Elliot Williams with DCSWAMU. I just wanted to follow up on a question from Michael about restrictions and potentially what would have to happen before going back to a stay-at-home order. I know you mentioned wanting to carefully consider the metrics and not rush into any decision like that. I'm just curious if there is a specific metric or number of daily case rate or number of cases that would precipitate going back to those early restrictions in terms of shutting down indoor dining and restricting gyms, indoor situations like that. Is there a number, or now that we're reporting on outbreaks, are those also weighing into that potential decision?
I think we look at the dashboard that you have reflects how DC Health makes recommendations to me about the state of our COVID response. So there isn't one of those metrics. I think they work together.
Thank you. And are there anything specific in terms of telling people how to be safe for the upcoming holidays, given what we've seen for Thanksgiving in terms of raising in cases? Is there anything more specific for the upcoming holidays?
I think that our winter holiday guidance is still relevant, and if we need to update it, we will. We talk about limiting travel and restricting your holiday gatherings to your household. And I think that's probably, we'll look to, I'm going to ask DC Health to look at the winter guidance again to see if we need to update it.
Definitely. And one more question, looking ahead to January, I know that the DC Council recommended against a reviewing tent for any inauguration celebrations or parade. Is there anything from yourself, Mayor Bowser, on what you plan to do for the inauguration in terms of attending? I know President-elect Biden recently said he doesn't expect too many people to be there. What are your plans, if you can elaborate on
I don't know
that?
that they have announced. I just saw, we've talked to the part of the inaugural team. I think they have another inaugural team. So we don't know what the events are. So it would be, the question. I know we're all want to talk about it, and normally we would be talking about inaugural activities at this stage, but the person being inaugurated has to make some decisions.
Definitely. Thank you.
Thank you. Any more? Yes, sir.
Question about the Housing Authority Board. You nominated Dion Bussey-Reeder for a position to replace an outgoing commissioner. I'm wondering, she certainly has a lot of experience working with communities, I think especially in Southeast, but as far as I can tell, relatively little affordable housing experience. I'm wondering, correct me if I'm wrong in that, but I'm wondering what you see as her qualifications for that board?
She's a great leader. You may know that she's the executive director of the Far Southeast Family Support Collaborative. And a lot of constituents of that collaborative live in public housing.
Okay.
Yes.
Question for Dr. Nesbitt. I mean, just generally, we all sit and watch what's going on here. And I think here in DC, obviously, you've been working hard to try to keep the numbers down. But as we look across the country, it's bad everywhere. Has this paid off at all in DC as opposed to, is this bad in DC? It's bad in Kansas, it's bad. Did it make any difference, the stuff you've been doing?
Yes.
So
It's made a difference.
I was going to ask you, Sam, because I have the benefit of speaking to my colleagues, and I'm sure you have the benefit of speaking to your colleagues in journalism. What is your perception of how DC has done compared to the rest of jurisdictions?
Well, you
Because
heard,
I get great
I
feedback.
think DC has done a good job, but the point is, it's high here, it's high there.
Well,
I think it's lower here
lower.
than it is in other jurisdictions. And I'm in different size groups, and I get feedback and I'm asked about things that we have done here, and people send me emails after those conversations and say, we're going to copy that. And my perspective, and I have to say this often to members of my team, because his work is immensely challenged. And I'm being very humble as I say this, because anytime that you've had over 700 people die in your community as a health director, and you have tens of thousands of people who have been stricken by this disease, where the long-term consequences are still unknown, it's very difficult to try to celebrate some modicum of success. But the fact that that number is not 10,000 deaths, or the fact that that number is not over, hundreds of thousands of people who have been stricken by it, I think we have to applaud how our community has taken very seriously the recommendations that we have given. So, we have modeled what this thing could have looked like. We did not have our worst case scenario. And I think that sometimes we have to take a step back and be proud of what the district has done collectively, not just what the health department has done, but what the district has done collectively for that not to have happened.
Okay, I'll take James.
Two quick questions. Mayor Bowser, as Congress contemplates another round of stimulus, have you and your administration worked with the Congress in terms of the district being considered a state as opposed to a territory? And my second question has to do with the convention center. There will be a surge early into 2021, and while the numbers are saying that the hospitals are doing fine, that might not be the case in late January. Is the convention center ready for that overlay?
Yes, so let me start with your last question first. We, as you know, made a considerable investment in making the convention center an alternate care facility, and Dr. Nesbitt and Rodriguez will remind me of the total number of beds. And we are doing some contingency planning now on what it would take to turn the convention center on if need be.
That was the first question?
The first question was
With the
about the stimulus.
Yes.
Yes, so in the HEROES Act, which the House of Representatives has passed with Congresswoman Speaker Pelosi's leadership, the district not only was delineated as part of state funds moving forward for CARES Act funding, it also includes the make whole payment of $755 million from CARES. As you know, there's reportedly a compromise bill, but we still don't have any information on that. Yes.
I'm wondering, a couple quick questions, just on testing now, it appears that you have switched platforms for registering, and the registration process requires now a photo of your insurance card. And if you don't have if you don't have insurance, you have to upload a photo of your driver's license or an ID. I'm just wondering why the changes, and if you're worried that might seem a little cumbersome to somebody who doesn't have insurance may not have an ID. And what happens to that person if they're not able to do insurance or upload an ID?
I'm not familiar with those details, Mark. Chris, do you know anything about this?
I do know that some of the registration services were updated to account for insurance, but we can look into some of the issues that you're raising.
Okay, and then if I could ask about the data, and again, I just want to thank you for all the data that you guys do provide, and
sure.
It's very much appreciated, and I know the work that goes into that. And I don't know if this is time better spent afterward in the gaggle with the deputy mayor, if you want to explain like what an outbreak is, why healthcare settings are excluded, and then as we break down these numbers, if I see 30 outbreaks, well, define an outbreak, and then how many cases does that mean, and then are we going to be able to drill down and see, what 30 universities had outbreaks or where those 30 outbreaks were, that kind of stuff?
Sure. So I'll start with the last question. We are not going to publish the locations of any of the settings. This will be the most granular of the level in terms of the settings. An outbreak would be 2 or more cases that have occurred at a specific location within the setting, the setting type, that have occurred within a 14-day period of time. It does not mean that the work of an investigation, a detailed investigation by a group of epidemiologists or case investigators has made a definitive link between those two cases.
Okay, and then.
Okay, so it could be as few as 2, as many as 20, 30, what have you. Yeah.
Okay, and then why are healthcare settings not included in the outbreaks?
So that work is done often outside of, let me start in a different place. So the way that this data is created is in 2 different streams of work. So we have a set of epidemiologists that can do case investigations by consultations that come in. And so to date, we've had while you see 190 outbreaks that we've reported, we've had nearly 1,500 consultations that have come in over 27 different types of settings or sectors, right? So that kind of gives you a hint that not every setting or sector may have had 2 or more cases that have occurred within 14 days, but they're definitely reporting that cases have occurred in their environment.
And then my last question on this data. Okay, I'm sorry.
Yeah, so healthcare facility, and then the second thing that happens is we have an algorithm that combs our database and can make connections that humans would not find.
So are we able to, because this doesn't seem to necessarily, and maybe it's not supposed to, line up with the data that you've given us about where you think the largest percentage of cases come from. We've seen, workplaces and I think restaurants and travel were like the top 3 behaviors or places where we're seeing, but that doesn't necessarily line up with the top places we're seeing outbreaks. And can you just square that circle for me?
Fantastic. 2 different things, right? So we create a big picture. The outbreaks is location-based, and the exposure data is activities-based. So
Okay.
that's where the difference that, as you view it, is coming from. It allows us to create a big picture.
Thank you.
Mm-hmm.
All right, last questions.
Yeah, so just looking at the outbreak data that's been published, I was hoping you could clarify with school buildings, is that mostly charter schools or what buildings specifically?
Any school buildings that are K through 12?
Okay, but you can't specify what type of school?
No.
Okay. And then also, I was curious to know, I guess the district now has a new basketball star. Russell Westbrook just came to the city over the weekend. I'm curious if you have a message to him, just as
I
a
think
new
I'm going to
district
have a
resident.
press conference about the Washington Wizards. I do. So let me just make that invitation to the Washington Wizards now. DC residents want to know. I don't have anything, I'm serious. I'm going to do that. And we'll do it hopefully, we'll do it. So let me make that invitation, and then I'll invite you too. Okay, yes. I said that was the last question, James, but you only had 2, and Mike has had 20.
Two quick questions, Mayor, and these are my Brandon questions. My first question is, Brandon Scott will be the new mayor of Baltimore tomorrow. Have you had any chance to talk to Mayor-elect Scott about being a mayor and any relationship in terms of Baltimore and Washington?
I haven't, and thank you for calling that out, but I'm going to take care of that today. I'm a big fan of Baltimore, and I became very good friends with Mayor Rawlings Blake. I served on the Mayor-elect Scott served on a committee that I chaired about the national housing crisis, and we participated with the National League of Cities. And that was really the first time that I'd spent any time with him. I was impressed with his thoughtfulness around housing issues and his love of Baltimore. So we're pulling for Baltimore. And I wish him my very best and will make myself available to him in any way that I can.
Speaking of our local Brandon, as you know, Brandon Todd will not be in office as of January, and he is your political protege. Has your administration reached out to him in terms of his future with your administration?
I was with Brandon over the last week, I guess, at the end of the week, where we were opening another Petworth playground, another playground in Petworth, I should say. And you should talk to Brandon about what his future plans are. Thank you.